Hello, my name is Josh Tucker, and I'm going to be doing an assessment of the ankle and the talocrural joint. I'm going to have my position in supine, or a long sit, and for the measurement of dorsiflexion, plantar flexion, I need to put a pillow under the patient's knee to make sure that the gastroc is slightly slacked. So I have about 20 degrees of knee flexion here. So to measure dorsiflexion, I put my goniometer with the axis just inferior to the lateral malleolus, and the stationary arm is going to be parallel with the fibula, and the movable arm is parallel with the sole of the foot. And I start him out in neutral, so I get him to 0. And then I'm going to ask him to fully dorsiflex for me. Okay, and that is about 12 degrees, which is a little less than normal because normal is 20. Now I'm going to do a measure of plantar flexion. So I have the patient in the same position, and I would place the goniometer in the same position. Get the patient to neutral. Stabilize at the tibia. And I'm going to go ahead and ask the patient to actively plantar flex. Okay, and he has a measurement of about 50, which is the normal range for plantar flexion. Alright, now I'm going to do a manual muscle test of the tibialis anterior. So I have the patient in the same position, and the tibialis anterior dorsiflex and inverts the foot. So I'm going to put the patient in that position, so dorsiflex and invert, and you can see the tendon pop out there. Okay, and to test the strength, I'm going to stabilize the tibia and place my hand on the medial aspect of the patient's foot. And I'm going to be pulling into plantar flexion and eversion. Okay, so don't let me break you. All right, I would give that a 5. All right, now I'm going to be doing a manual muscle test of the tibialis posterior, which plantar flexes and inverts the foot. So having the patient in the same position, supine long sit, I'm going to have the patient plantar flex and invert the foot and hold that position right there. And I'm going to stabilize the tibia and grasp the medial aspect of the patient's foot, and I'm going to try to evert and dorsiflex the foot. Okay, resist me. All right, now I would give that a 5 out of 5. Now I'm going to be taking a muscle length assessment of Mark's gastroc. So to do this, I have the patient up against a table with one leg bent in front of the other, and the back leg that I will be testing is straight, as you can see. So I'm going to use my goniometer, just like the range of motion, and I'm going to have the patient lean forward as far as you can into dorsiflexion till your heel begins to rise off the ground, then stop. Good. Okay, now I'm going to measure. Axis inferior to the lateral malleolus. This time the stationary arm is parallel to the sole of the foot, and the movable arm is parallel with the fibula. And I get a measure of about 25, which indicates no restriction in Mark's gastroc.